thanks for your interest. I think this is really the best part, is just getting the voice in the ears of some of the funders, just to be able to have a nice casual conversation about some of the challenges and also opportunities that we see. So just real quick, the Village to Village Network is a joint 50-50 partnership between NCB Capital Impact and Beacon Hill Village. NCB Capital Impact is a national nonprofit organization, also a community development financial institution. And our mission is to really help people reach their highest potential at every stage of life. And so we do work around charter school development, as well as community healthcare clinics, fresh works, fresh food, bringing food to food deserts. So, just kind of the whole health of the community. Our work in our aging strategy started with the Robert Wood Johnson Foundation funded Coming Home program in 1993. Where we did a lot of work around affordable assisted living and really looking at different ways you can use Medicaid policy, affordable housing finance policy, and licensing to really change the face and choice of that model. And I think what we took out of that after 13 years of implementing that was that, it's not, if you're really going to talk about choice and independence, then what we really need to do is create a wide array of services, whether they be place-based or community-based, that it creates a spectrum within the community, and then people can enter in and out either by episodic transition or just because of their own individual preference. And so that is really our focus of kind of looking at, I've been the director for our Center for Long-Term Supports Innovations for 9 years, working around kind of looking at the holistic and comprehensive systems, not only locally, regionally, state, and federally, just to kind of figure out where are the pieces that need to fit together. Because aging is not, in silos. You can't just fit in boxes of housing and healthcare and these things that we really need to be connected. And so that's a lot of the focus of our work. And so in about 2007 is when we heard about the village model. I think we got the same Jane Gross article that everybody else read and spread across the world. And we identified it as a really great, innovative model that, fit into our mission. It fit very much aligned with what we were working on, the person-centered approach, the real grassroots nature. NCB Capital Impact is and started out as the nonprofit affiliate to the National Consumer Cooperative Bank, NCB. And so cooperatives and that sharing and that self-governance has been our foundation of our work and our philosophy. And so this fit all these kind of pieces. You can put the stars in all the places across the Gantt chart, yep, all those things. And so we set out in 2008 to build a partnership with Beacon Hill Village. They had identified that, because of that article, they really had set out to do something that just addressed the issues right there in their neighborhood. That's what they set out to do, never thinking that they had built this model that everybody in the freaking world would want to be part of. And 3,000 calls later to their office in one day kind of said, oh, okay, well, our 3.5 FTEs, let's go handle all those calls. And so it was really great to have that exchange with them, because we are, we can take things to scale. We've known to take replication, but we also wanted to champion the innovations at the local level. We didn't want to fit in a local box. We felt that this is a model that's adaptable. So the Village to Village Network is a response to the commonality of requests that were coming into Beacon Hill Village. How do I get started? Where do I fund this? What's the technology I need to use? And it used to be, if you want to start a village, pre-Village Network, it was a lot of one-to-one conversations happening. You call Beacon Hill, they say, oh, call so-and-so in this state. We know about, Joe down here that's doing this. And again, it was this one-to-one exchange, as opposed to how do we create a place where all the peers that want to, in the village space and any community wants to learn about it, can really come and have a multifaceted conversation and discussion. And so we built the hub. The Village to Village Network is electronic based. Our hub is the website. And we have a member-only, it is a membership-based organization. The cost of membership is $350 a year for an organization. That allows access up to 11 people from that organization that can be a part of an exchange as a private user and username and password. And we built things in response to what the members needed. They wanted a discussion forum where they could just post the burning question of the day. I don't know how to set my membership fees, how do you do it? And you'll get responses, and people will, and it's very interesting because they self-police, which is really intriguing to me, because we, staff are like, well, how do we get them to respond, and what happens if nobody posts? Well, this is not going to be a problem. It's really not. But once in a while, there'll be a question that doesn't get an immediate response, and so we kind of keep an eye on it. And if it goes about a day or 2 days that nobody's responded, I'll go in and try to, generate some type of response, or at least give that connector. And so I remember getting that at one point and going on, and I was just about to do something, and posted this gentleman who was a very active member of the network said, well, we need to be able to respond to these. It's been too long, as he had been watching it, and it had been too long since somebody had answered that. So it was really intriguing that they're pushing themselves to do that. So the discussion forum has about 600 threads of different questions and whatnot, and we put a keyword search in, so now you can go and search, I want to talk about volunteering or transportation or whatever it is. We have a document library, which I think is one of the real critical key factors that has helped villages to not recreate the wheel. Any member can upload from their desktop anything they want to share with the network. We have 501c3 applications verbatim scanned. We have articles of incorporations and policies and procedures, membership applications, things that, folks that have created and said, well, I want to share this because this is our good work and we want to promote what we've done. It gets captured for about 5 seconds in my mailbox just to make sure that it gets filed. We don't review the forms, we don't police them in any way. We just want to make sure that business plans didn't get stuck in volunteer membership. We also do 4 webinars a month. 2 are topical webinars. 1 is open to the general public because we want to encourage people to engage with the Village Network. But we also want to make it your membership value added, and so we do member-only webinar that's specific to topical. We've run series on board development, on financial feasibility, to how do you develop strategic partnerships, to fundraising, to the whole gamut. And most of that is generated by the members saying, we'll either look at the discussion board and say, this is a hot topic. People are really, really fired up about board development. Let's do a series on that or whatnot. We also have an advisory committee, 11 member advisory committee of both of open and in development villages from our membership who serve for a variety of years. The longest is 3-year terms, but we've got 1 and 2-year terms as well. And we also provide the 2 webinars that we do that are not topical. We found that really just wanted a space that they could come and talk to their peers. And so we have the Village Voices. It's the 4th Tuesday of every month. If you have a burning question, we'll have 10 people on, we'll have 20 people on, we'll have 5 people on, depending on who it was. And they just want to talk to somebody. I have this issue today. What do I do? We found that a lot of questions about technology were bubbling up in the Village Voices, so we created the Village Tech Talk to be able to let the technology gurus kind of chat amongst themselves. And out of that, we were able to customize. When we first started out with the Village Network, we identified that folks really wanted to have a technology solution that would help them run their organizations efficiently, that created all the back office that was already built in. And so we went out and looked at a lot of different technology. In 2008, obviously it's a lot different today, 4 years later, but the technology that was available, we found an association management software service, software as a service vendor. And got us about 85% there. Things are built in. You can take your membership fees at lunch. You can export to QuickBooks. You can run your back office, and it also has built-in reports. And so when you're talking about evaluation and talking about measuring your impact and also understanding kind of what your organization is doing, those were built in, and so we felt that that was an important component. But we customized 2 pieces out of that: the services module, so that anyone who calls into the village, you have your service providers are already in a database. You can pull them up. You can do scheduling. You can measure, kind of manage that. And so what's interesting is that out of the Village Tech Talk came the need for a volunteer management module or component that went into that services module. And so, it was interesting because you talk a lot about the value that a lot of our older adults bring in expertise and knowledge and just lifetime of expertise. The volunteer module was actually realized by 3 men who had all worked, 1 at IBM, 1 at Google, 1 at Dell. The cost of getting them as private people to sit down and write a program would have been astronomical. They volunteered their time. This was a solution that helped them. And so we really are leveraging those memberships, which I think is really great. So in the Village to Village network as a whole is really about focusing our promoting the village model, replicating and scaling it, but also doing a lot of the research and evaluation and really talking about how do we make an impact. Are the villages actually solving the points or outcomes that they have set out to do? And then also how do we look at this model to ensure that it can fit for a lot of different populations, both low income, culturally and ethnically diverse, and whatnot. And so those are kind of the piloting pieces that we can do at the national level with some of the local partners that we have, in addition to strengthening the capacity and supporting our members, but also championing the innovation. One of the really great things about the village model is that it's really adaptable to the community. It doesn't sit in a box. It can, the community can take it and make it their own. And I think that that's a blessing and a curse. It's really great when it comes to, community having a vested ownership and getting them off the ground, but at the same time, measuring its impact and consistency across the board is a little challenging for us, but we'll take that challenge. And so that's essentially the network. We do a national conference. We have that. We started last year as part of our MetLife Foundation grant to start out doing some seed grants, small level business and sustainability operations grants. So those funds that are hard to find for villages on capacity building or writing business plan, or the small $5,000, $10,000 grants that tend to be difficult, but are meaningful for the building that kind of infrastructure foundation in the organization. So we focused our funds specifically towards anything that around business and sustainability. And it's interesting because we could ask up to $5,000. You have to match it 1-to-1, but you're gonna have to ask for the full 5. And so we got this really great Sacramento Mountain View Village in Riodiso, New Mexico. So we just need $1,200. Just need $1,200 to get someone to write our policies and procedures before we all die and we can't remember. We will give you money for that. That is an easy fix. But that's not something that, funders are really looking, to give that small little discrete. So if we can help in that way, but we certainly see that as a place where we can add value in the future going forward. We have also launched this week our Village Better Buys, which is our membership group purchasing opportunity in response to some of the members to try to get some national discount. So the villages can tap into access to background checks that are lower in cost, or director and officer's insurance. We're trying desperately to find health insurance, but that's going to be a whole nother conversation. At some point I won't deal with that. But those things, but also are there national organizations that offer services and products that might be value added to the village to offer them to their members. Everything is opt-in. No one's required to take any of the membership benefits at all. We just want them, make them available. We request that the villages do their own due diligence. They're their own organizations. They're their own businesses. They need to go through that vetting process just as diligently as everyone else. We always want to just say, we've looked at these, we found these, and these work. So that's essentially as we go forward. We've got a couple pilots going on. We worked in the southeast Michigan and the Detroit area doing some village time bank hybrid models, trying to figure out new ways of kind of looking at, especially for lower income populations. We're currently in partnership with UC Berkeley, and the Archstone Foundation with a multi-site evaluation of 9 villages throughout the state of California. Some are in development, some are open, some have been open for a while. And we just finished up a 2-day community walk. A group from Phoenix was there for the 2 days and to learn about that project too, which was really exciting. And so we'll continue to do those types of work. Laura and I are figuring out our little ways of making something work. And so, so I think it's really great if we can just add capacity and we can add value in any way, and also, just highlight the really great innovations that local communities are doing, because this is, doing it on their own, which is really amazing. And then making the connections to Affordable Care Act, and then kind of health indicators in the future, any access and impact that where we can save costs and whatnot is really an ideal opportunity for us that needs to be here. Any questions? Yes, ma'am.
How do people define community?
How they define it. I think that's the best part. It really can be defined by neighborhood, a geography. You can use geographic definitions. What we're finding in California, actually in Orange County, one of our villages, is that they wanted to do a hub and spoke model of the village, and they defined the community by geographic area and then realized that they were multicultural. And so they had a lot of language issues, so their communities are now based on culture or ethnicity as opposed to community, as opposed to neighborhood. We have villages that are countywide, we have villages that are 2 streets, we have, you know, it's kind of just however they decide to define community.
It's still very experimental. I don't think
Extreme.
we're anywhere near a standard or will ever be near a standard. And the population we work with now, not knowing how the young 60s will be 10 years from now, but they understand community and they understand neighborhood. And so I think they will have a slightly different characteristic than the people who are turning 60
Right.
10 years from now might have. And I think these communities will change and evolve with the differences in the population and understanding.
And the village's model itself is set on a set of guiding principles, and as long as you kind of meet those,
Yeah.
okay, you're good. You're part of the club, so to speak. I mean, but I think that those can evolve, and you know, I think that there is something to be said about having a predictable roadmap that at least provides some guidance that are standard. I mean, village development is not unlike starting a nonprofit organization. The foundations are exactly the same. This is not brain surgery, folks. This is starting a nonprofit. What's unique is how you're engaging your volunteers, how the governance structure is developed, and also how services and products and programs are derived, identified, and also implemented. And I think that's where the uniqueness comes as far as making the connection of not trying to replicate what's existing in the community, but rather leveraging everything that's there, not trying to build new, but make sure that the services are available to a whole income stream. We know that I've been told the villages are the gated community of aging services. And yet, yes, they are serving a moderate income population. I think and what that response has been is that many of the organizers don't feel like they can go to a senior center. They can access services because they make $10 more than the Medicaid eligibility. That doesn't make them rich. It just means that they don't have anything to access. And so where can villages kind of play that role for the tweeners, so to speak, in making that? But I think that the case is also being made that when we talk about Medicaid and Medicare and dual eligibles, and we talk about the costs involved with states and communities, we talk a lot about how you create efficiencies within the same populations currently being served, but how are we also measuring cost avoidance by keeping people where they're not spending down to Medicaid, that they're not adding to the demand, I think is also a really critical component to not increasing that demand to an overburdened system already. And so I think there's value add there. It's just the measuring of that. One of the things that villages, I think, also do is this is not an aging issue. This is a community development. This is economic development. This is engaging all parts of your community as a component. And I think when we talk about livable communities, when we talk about expanding that, this is a critical component of bringing everybody to bear, all forces within the community to bear to do that.
One of the things that I think we learned in Arizona maybe 20 or 30 years ago was some city was created. Everybody assumed everybody was going to be 55 and be healthy and play golf, until the day they dropped dead. And those communities evolved, and suddenly we had a group of 85, 90-year-olds, many with chronic health problems, and communities that weren't, structured in a way to support those folks. Now the communities have evolved significantly over the last 20, 30 years to be able to respond to those folks. But I guess the question is, as you talk about these villages evolving, is there, first of all, do they tend to develop around a certain age group, and is there a conversation already taking place in all these about how we evolve?
I feel
They really vary. For example, although we have a certain age group, we do not have an age requirement. Many villages don't. What is interesting is your comment that you made before, that they were so isolated, many of you, that you found in your research. That is the one thing that we focused on, because the worst thing you can be is a suburb. These villages work very well in cities, but suburbs have 3 times the problem, and you can really star that transportation as number 1. But what we found out is that the best thing we could do is build community. First of all, the seniors have to come together and do 75% of the work. And even those who are home-based are volunteering by making our calls. If we have a series of calls that need to be made to people because they are being asked to be called once a day, there are things they can do. So they're really engaged. They're not assumed that we're caring for you, but we're caring for each other together. And in the process of that, we go to the wider community who wants to suddenly become engaged. And so that is what becomes important. I think if you're sort of serving the elderly, you sort of put them in a group as if they have a problem or an illness or a sickness, or you're expecting one, rather than engaging the elderly from the very beginning as the leaders. So our members, we ask them, are you volunteering? And we do services as our village. We serve the community. We have 2 or 3 activities a year that we do for the community. So we're reminding people we are active. And these people in Fairfax County, if we didn't have seniors, we wouldn't have half the nonprofits that we do. There's a lot of people who retire there giving their full-time efforts to so many activities around, and we forget that. These people are so valuable. So I think the village movement has really identified that as an important component.
And I think it's also one of the really great things is that it's starting to identify a space where private businesses can play a role or be engaged in some way. We have long conversations about family caregiver and obviously the informal caregiver and the impact that has on private businesses as their employees are having to shuffle as a sandwich, what do I do, how do I do this, and then obviously the cost to the business is that lost productivity. And so any way that they can support, whether we've got a couple individuals, villages down, or at least one in Tennessee that's been working with the private industry, large industry, to say, can you make membership to the village an employee benefit? Will you pay for that as part of your employee benefit? Are there ways that you can look and support flexible hours for caregivers so that they can have that, or that they can have that support? And I think that that's a really critical component. Health plans are also being engaged again as well to say, right now they reimburse, some reimburse for gym membership. This is a very much equivalent to that it's just even more impactful because the village actually is something you'll go to as opposed to the gym, but however, it certainly plays a role in and then now as we have hospitals being dinged for emergency rehospitalizations, there's a critical component that where villages can play a role in discharge planning. So there's a lot of places that this non-medical wraparound supports that the villages actually absolutely are critical to some health interventions and really that regimen. So it's really exciting on how that happens.
What we haven't done, and I think is very important, and we've been talking about research generally, the movement is, maybe 10, 11 years old now, but we really need to think seriously, and this is something that donors can think about. When we talk about evaluation and impact, how down the road these villages, not only because they're good for the people in them, but they do take a burden off public funding. And why do they take this burden off public funding? Just what you were saying, do we keep people out of permanent institutionalization? There was a study of people with Alzheimer's a few years ago that was in the New York Times. And if you can keep an Alzheimer's patient out of an institution for 1 year, per person you're saving over $100,000. So we're talking about keeping people in their communities. It's a win-win for them, it's a win-win for the community, and it may be a win-win for public policy so that this subsidization, even through Medicare in the future, for you to get into a village and be part of a community, would be wonderful, because ultimately it's saving public funding in the long term, and private funding, but mostly public funding. And so those are the kinds of things that we need to be able to do across the country, is begin to think of how we start measuring that, so that we do have an impact statement 9 or 10 years from now, because it will take that long. Some type of data gathering effort that each of the villages would sign on to, that wouldn't be a big burden. 2 or 3 key numbers that they would collect each year would have a powerful impact on helping foundations even, or public officials understanding the value of these villages.
One of the things that we're looking at in New York, because you know, our oldest group is going to be 5. They're having their anniversary next month, so we've been looking at it for 5 years. And when they started, they were initially looking at a younger old population as the people they were going to serve. You know, 65, the newly retired, looking for opportunities to engage in their community. But the reality of it has been very different. Most of our membership is 75 and older, 75 and I would even say 80 and older. So in terms of the evolution of the model, we are looking now at, you know, are our villages going to be equipped to take care of this older population with higher needs? And one of the things we have been working on is a proposal with some academic and health partners in our community to get funding to really look at how can we actually take some of the members of our community who are looking for work, as you mentioned, that was one of the big issues, and put them through a training program. One of our academic partners is Sarah Lawrence, which has one of the only health advocacy programs in the country, and actually put these people through a training program to train them as community care advocates, where then when individuals are discharged from hospitals or from acute care facilities, they're assigned to a person in the community that's going to follow them for a 3-month period to help keep them out of the hospital and integrate them into the community for all the social and health benefits that come with it. So, again, for funders, those are some of the things that we're looking to do, again, to demonstrate that there is impact. We do have a database that most of our members, input information into in terms of rides that they give, friendly visits, social activities, and so forth. And in 2011, we, recorded well over, I think, 12 or 1,300 rides that are given. And I would say 90% of those rides are to medical appointments. So, anecdotally, we can say we're contributing to better health outcomes, but, we don't really follow it through. So I agree with you in terms of really needing to get the impact. That said, it's incredibly difficult to get volunteers to start tracking that kind of information.
Yeah, the Archstone Foundation, I think, was the first real multi-site evaluation of villages that's collecting real data, real-time data from their members, for not only for satisfaction, but also service utilization and some of the health indicators. And I think out of that, we're hoping that will inform either good tools that villages can use, although the tools right now are a little administratively burdened. I'm like, no way, villages are going to collect this, so how do we have that collection of data that happens is just a part of the natural face of business. And one of the pushbacks that we get a little bit from villages is that, well, I'm asking my neighbors about their health status or their income. I don't want to know that, So is there a way that we can do this on a national basis and push everybody up to an anonymous kind of data capture? And that's certainly what we'd like to be able to do. The Silverman Fund has been really generous in helping a team of UC Berkeley, Rutgers, University of Michigan, and Penn to do a comparison data of villages to NORCs to other aging in place. And so I think some of that will help with the impact analysis. We're also looking at measuring the differences between those and creating some benchmarks. And I think that if we can create a set of benchmarks, the village on average of the Silverman Fund respondents of the 80, at the time, 83 open villages, or 90 now, the average amount of time that they've been in existence was 3 years. So these are, we look at it from a small business startup standpoint. They're still in that 3 to 5 year startup phase, so there's still a lot of work to be done as far as creating we can help to create some of that infrastructure that can be implemented. If there's consistency across the board, we want to do that because we want to identify, having the space and time to do a longitudinal study. Yeah, if there's a way we can do, we talked about secondary research also, and kind of looking at what existing evidence-based programs are being implemented within the village space and how those are making, we certainly can cross over to that.